Welcome to Biztech's Health and Wellness Show. Today we feature the Malaysian Society of Ophthalmology. The Malaysian Society of Ophthalmology is a professional organization representing medical doctors specializing in the field of ophthalmology. Now, here to tell us more is its president, Dr. Manoharan Shunmugam. Now, welcome to the show, Dr. Mano.
Thank you, Brian. Thank you for inviting me.
Now, Doc, can you please give, for a start, tell us a little bit about yourself, your training, and what ophthalmology is all about.
All right, sure. So, ophthalmologists train as doctors in general first. So we do our 5 years of medical school, and then we finish our housemanship, and then we go on to specialize in general ophthalmology. And if you wish, then you can do a fellowship in subspecialties. And we've got many subspecialties in ophthalmology, which include things like pediatric ophthalmology, retina, uveitis, glaucoma, cornea subspecialties, neuro-ophthalmology. So in all, it takes us about 8 to 10 years to become subspecialists, about 5 to 6 years to become general ophthalmologists. And the Malaysian Society of Ophthalmology was established in 1964 as part of the MMA. And then there was a small group who decided to start their own society, and that happened in 2008. So now we are an independent society with about 800 plus members, the Malaysian Society of Ophthalmology.
Now, Mano, what do you feel the level of awareness is among the general public about ophthalmology and the need to look after their eyes?
So I think now, especially with the pandemic, it's definitely becoming more prevalent, more obvious. Ranging from children to adults who have been working from home, and even the older adults who have not been going to see their doctors because of these recent numerous lockdowns. So we start from children. To give you an example, a lot of the schooling has been online, as I'm sure you know.
Yep.
So many children have been, stuck indoors and glued to their gadgets. So we're actually already seeing a myopia epidemic as a result of this. So there are more and more children who are coming in and suddenly seeing that they need glasses because they've all been indoors looking at their screens. And so the body's adaptation to that is it makes you more short-sighted. And you only have to look at countries like Singapore, China, and Japan, where their rates of myopia are extremely high. And Malaysia is catching up to that, actually. And this pandemic has accelerated it, I must say.
Now, Mano, one of the key things is when we think of our eyes, traditionally we think of optometrist. Could you make the distinction for our audience in terms of ophthalmologist and optometrist?
Okay, yeah, that's a great point, actually, because many people don't know the differentiation. So ophthalmologists are doctors. We do medical school and we perform surgery, we prescribe medication, and do procedures on your eye, like be it surgery or laser. Whereas optometrists, they do an independent course. So they have a 4-year course in general. And they focus only on the eyes. They don't study about medicine, so they cannot prescribe medicine, and they do not operate on you. A lot of them can examine your eyes very well. They can prescribe glasses, but if there is anything that needs intervention, especially if it's medical or surgical, then we work together well with them. They refer patients to us for that.
Now, in a Malaysian context, what are the key diseases related to ophthalmology that are common right now?
So, as I mentioned, one of them that is upcoming is myopia, because myopia causes many things down the line. Other things that are not frequently thought of are things like glaucoma. Diabetic retinopathy is on the rise, and it's one of the leading causes of avoidable blindness in the working population. So that's something that really needs some attention to, because the rates of diabetes in Malaysia are very high. It's a non-communicable disease.
Yes.
And diabetic retinopathy screening is not as high as we would like it to be. The other thing is glaucoma, which also needs to be screened in everyone over the age of 40.
And there are 4 types of glaucoma, isn't it?
There are many types of glaucoma, actually. It's broadly classified into primary open-angle glaucoma and narrow-angle or acute glaucoma. So, but there are many causes of glaucoma.
Okay, and generally there's also age-related macular degeneration. Could you kind of highlight some of the causes, symptoms, and the treatment for that?
Sure. So age-related macular degeneration typically, or by definition, occurs in those over 50. And I'm not saying that because I think those over 50 are old. In fact,
so I belong to that.
But this was defined years ago, decades ago, I should say. So it's in people. It's basically a degenerative condition, which is again classified into wet and dry. And it's due to aging of the retina, and you get leakage or bleeding under the retina, and that typically affects your central vision. So it can cause gradual reduction of your central vision, which would affect things like facial recognition, reading, watching TV, driving, and sometimes it can be very insidious or it can be very slow. So in those over 50, we usually advise them to get an annual eye check
Okay, so Mano, this is interesting because many of us, that's not part of our DNA. In terms of, we think of other checks, we never think of having an annual eye check.
Yeah, absolutely. So what we would advise you, so if we're talking about screening as such, the one thing that we always say you should get screened first at birth is your eyes. Now that at the moment is a very rudimentary check by the pediatrician. So we say you should get a comprehensive eye check by an ophthalmologist, and then every year until the age of 12, because children won't be able to tell you if they cannot see. So you've got an annual eye check from birth to 12, especially before you go to school, preschool at age 4, and then again from the age of 40, annual eye check, and that's to look for things like glaucoma, diabetic retinopathy, if you have diabetes, age-related macular degeneration, because a lot of these things, the patient will not know they have them, especially glaucoma, until it's too late, and then you cannot save it. You see, you can't reverse the disease process. But if you screen and you find it early, you can actually halt its progression.
Okay, I think that's a key thing, right? Halting the progression, because many things, as you said, are not reversible, but halting the progression is something that we can aim for. Because I think when we are in our 50s, one of the things that we noticed, and I noticed that very dramatically for me personally, just looking at the phone, I suddenly have to now stretch my hand a lot further from my eyes in order to see my phone, read my phone more clearly.
Yeah. So what you are describing is presbyopia, which again, like you said, happens to all of us, unfortunately. So as you get older, you know, after you hit the age of 40, 45, 50, you're quite lucky, in fact. You just need to get a pair of reading glasses most of the time. So if you go and see your opticians or optometrist or basically a glasses shop, they'll be able to fix you up. And in fact, many of these shops are able to also screen your eyes in a bit more detail. And if they find a problem, then they refer you to a doctor. So this screening can be done in the community as well, at any optical shop or glasses shop who have the facilities. But if you have other conditions like diabetes, then you probably need to see an eye doctor. And children under the age of 12 sometimes also require to be seen by an eye doctor.
Okay, so Doc, you've opened our eyes into quite a few different things.
Yeah.
In terms of, I think the key theme being screening,
yes.
Starting not only just for older people, but for very young children as well. So could you give us a checklist of perhaps of what we need to do to take good care of our eyes?
Okay, yeah. You want to ensure that, okay, let's start with those at birth first. If you have any family history, any siblings or parents have got any eye problems, you need to take your children to see an eye doctor, because some of these things are hereditary, and I see a lot of them going undiagnosed or undetected, and so if that's the first thing, family history. Even things like glaucoma, can run in families sometimes. If you notice, things that are very obvious, if you're missing steps, or if you see your children not being able to pick up things, or see the aeroplane that's far away, then that's pretty obvious. A very common thing is children not doing well in school. Perhaps they're not sitting close to the board, so teachers frequently pick that up. And to rectify it is just, most of the time, just getting a pair of glasses. And then there are the more obvious things, like if your eyes are squint or they're both not pointing in the right direction, you need to see an eye doctor. Sometimes when you take a photograph of someone, you see a white reflex. Normally it's a red reflex, but with a lot of the modern cameras, the reflex is suppressed. But sometimes if you see a white reflex, then you need to be seen by a doctor. If you have other medical conditions, diabetes is a big one, then you need your eyes checked annually. If you suddenly notice poor vision in one eye, a lot of people, even adults, don't realize that they have poor vision in one eye, because a lot of the time, just like how people are right and left-handed, you use your right hand more often. So people are right or left eye dominant. So a lot of the time, most people are right eye dominant. So if you have a problem with the other eye, which is non-dominant, sometimes the brain suppresses it, and you don't realize until you close your dominant eye. You think, hey, hang on, I can't see. So just do a self-check. It's very simple to do a self-check. Close one eye at a time. And if you're not sure, if you have any sudden loss of vision or pain or anything like that, it's best to get your eyes checked at any optical shop or eye doctor.
Now, one of the things I want to ask you also is, which I'm sure plays a very big role, is the role of nutrition. And deficiencies in certain nutrients may cause some eye disease and eye problems with your eye. Could you shed some light into that?
Yes, so that's actually a very important cause of poor vision, mostly in developing countries. So in Malaysia, we don't really see much lack of nutrition, but rather malnutrition due to poor dietary habits. And one of the poorest dietary habits is actually having too much sugar. We see a lot of type 2 diabetes, and even in children, not eating the right stuff, not getting your fresh fruit or vegetables, and eating junk food basically. So you can actually be malnourished as a result of that. It's not often, but you do see it in some of the B40 group as well. So,
and is that reversible though with better diet?
Yeah, some of these things are, yes, especially if you catch it early enough. To see it at a level where it's not reversible is actually quite rare.
Okay.
Because a lot of these, like cereals are fortified, etc. You have to have had a really poor diet to be really malnourished. So that's very unusual. But what I can't emphasize enough is that even adults, to have enough fresh fruits, fresh vegetables and fruits, green and leafy or colorful vegetables are very good for your eyes as well, and not to eat too much processed food. So processed food is very bad.
I think that's a big problem with all societies, Malaysia included, because processed food is convenient.
Yes.
Processed food is often cheaper as well, and especially in a pandemic, and the broader population has been impacted financially. The switch to processed food, I'm sure, has happened quite significantly.
Yeah, absolutely. You're right. But the other thing that has happened in the pandemic is more and more people have been cooking at home.
Yes.
Which is a good thing. And one of my colleagues wrote a book about nutrition, food and the eyes. So you can look that up as well.
Fantastic. You should tell it, and we'll put it in a link. Go and click on it and go and find out a little bit more. No, but what I want to do is then ask you, I think take a more macro view now and ask you about Malaysia as a whole and how the pandemic has exposed gaps in our healthcare system, particularly with regards to ophthalmology. Could you shed some light on that, and where do you think we need improvement?
Yeah, so I think the gaps in our healthcare system, especially if you're talking about the government system, the government has been, I would say, impacted the worst in this pandemic, because they've had to care for a lot of the patients impacted by the pandemic or COVID, or had COVID. So they've had to close their doors to a lot of their normal patients, and they were already operating at a level which, with very low tolerances to such problems.
Is that, and you say low tolerances, is that an equipment related problem or a specialist related problems? Do we have enough ophthalmologists in Malaysia?
No, I think per capita we still don't have enough specialists, and if you look at the distribution, most of us are, in the bigger cities within Klang Valley. I think about half the retinal surgeons are in Klang Valley, and the other half are distributed throughout the country. So there's definitely a maldistribution, both in private and public, and so there isn't enough service in these areas. So that's one, but also in terms of human resource, in terms of equipment, and the pandemic has definitely also impacted training. So a lot of operations, especially those that are considered routine, have been postponed. The backlogs are getting longer and longer. So for patients who have had non-COVID problems, their appointments are getting pushed. And the disease, in the meantime, the disease is getting worse. They're not getting their regular medication. And just to highlight actually a very important issue that we recently brought up to the press is patients are taking to social media or getting duped by a lot of these rogue companies who are trying to sell herbal products or products with dubious chemicals in them, saying that they are panacea for treatment for whatever, glaucoma, diabetic retinopathy. And these patients, because they haven't been able to get their regular medication, are buying these things or stopping their regular medication and then getting worse. So the society is being duped by these companies, a lot of whom are operating from overseas, from China, for example.
And so you've highlighted quite a number of key challenges facing the profession as well as healthcare in terms of patients.
Yes.
And then we've got to couple that with the fact that because of the diminished access, maybe some of these patients have to go to private practitioners, which then leads to another story, which is healthcare costs are rising, medical inflation is in double digits over the last 10 years.
Yes.
And with regard to ophthalmology, most Malaysians are not insured or underinsured, so cannot afford the treatment. Am I correct, or is that something that is not true?
No, I mean, I think you are right. A lot of patients still don't have, many patients still don't have private health insurance. And with this recent pandemic, one of the things that happened was many of the government hospitals, university hospitals were decanting patients to the private and funding their operations in the private. But that at the moment, it's not a sustainable system. There's no avenue that's been drawn up. That was more of an urgent or a stopgap measure. And it's something that is not happening in Klang Valley anymore, as far as I know. But we do see now and then government patients which are being sponsored by the government in private healthcare institutions. But in terms of
private-public partnerships in healthcare work in the long run, or again, is it just a stopgap solution for now?
No, I think it's the future. I think it's definitely the future, because the government system actually, whatever said and done, can be very efficient. The amount of money put in per capita for our GDP is much lower than other countries, but the government doesn't have the capacity to treat the whole population, and there are certain systemic factors which does affect its delivery. Private healthcare, on the other hand, have an overcapacity or oversupply of beds per capita, especially in places like the Klang Valley. So I think this redistribution of healthcare in a public-private partnership would be ideal. But that is something that needs to be discussed at a much higher level.
Yeah, because the challenge is, of course, the government institutions actually own many of these healthcare practitioners. The likes of IHH and KPJ.
Yeah.
So you have this challenge of left pocket, right pocket, and how you move forward that's right for the overall population, or is it right for the shareholders? I think that's the dilemma that they are faced with.
That's one thing, but the other thing is service provision, and I've been fortunate enough to be involved in a public-private partnership contractually with the government as part of my practicing institution, and I think that's something that can easily be sorted out because we are already in the private sector. We're already very used to providing, sort of packages to insurance companies. We frequently have packages for private patients. And doing another package for the government sector it can be done very easily. So it's something that can be done quite soon, I would say, if there is the initiative.
Yeah, because I think with regards, very recently, I think the government did a partnership with some members of APHM to send patients over to the private sector to reduce the burden on the public health system.
Yes, correct. Yes.
Now, so how has the Malaysian Society of Ophthalmology engaged the government? Because you've identified quite a number of areas that the government or the system needs help. What has been your emphasis in terms of engaging the government?
So we actually work very closely with the government as well. Many of our members are still practicing in the government in many of the university hospitals throughout the country. Even on our committee, we're very well represented in that sense. Most recently, to give you an example, we had a fundus camera, which is a camera which takes a photograph of the back of the eye, which was donated to us by B&M. And we actually, we were doing diabetic screening on our own. But because the pickup was a little bit slow, we actually worked together with the government and parked this camera in the Clinic Kesihatan, and there it's been doing a lot of good. So the government is using that as well. So that is one of the very specific partnerships that we've had with the government. More recently, we are also working with them on myopia prevention. There's the recently set up under the MSO is the Myopia Advocacy Board for myopia prevention. And also we are currently working a very big project with them on diabetic retinopathy screening. So the government has had this program working in the government for many years now. So they have all the protocols in place. But in the private sector, it's a very fragmented system of getting patients to be screened for diabetic retinopathy. So we're trying to equalize it and provide the same kind of service in both public and private so that patients can slot in anywhere. They can walk in to an optometrist or a doctor or a GP or an eye specialist, get their eyes screened and be part of one unified ecosystem where they can, if they are picked up to have diabetic retinopathy, they can go into anywhere, university hospital, government hospital, or private hospital. Of course, there are cost implications for that, but at least the patient has been screened and we know we have a centralized database of their eyes, their demographics, etc. So that's going to be over the next 1 or 2 years. We are working on that at the moment.
That has been always the holy grail. I think from the days of the telehealth program in the 90s or as part of MSC, centralized repository for medical records that can be accessed by both public and private practitioners.
Yeah, absolutely. So like you said, a patient health record so that the record is owned by the patient. And our IC system is ideal for that. As ophthalmologists, this is one tiny step that we are trying to take towards that.
This is obviously part of that whole digital health initiative. Digital health has now come to the forefront again after being on the back burner for some time. How are you all evolving with the times? This is obviously one initiative. Are you all working on any other digital health type initiatives?
Yes, so as part of this project, the government has already engaged an AI provider, where we take a photograph, the AI system interprets that photograph of the back of the eye, and it can tell you your risk of having diabetic retinopathy. Not only that, also of cataract, of your risk of glaucoma. So all that is done automatically. You don't actually need a person to read it, and then it can flag it up. And they also have algorithms where they can tell you your risk of cardiovascular disease and other things as well, just by looking at a picture of the eye. So we are hooking up with.
That's very interesting.
Yes. So that's the next level. It's already been done, and at the moment there's a lot of machine learning that needs to happen, because a lot of these systems are developed in the West, in Japan, where their demographics are a little bit different. You know, the pictures of the eye are just slightly different, and you know, computers are computers. They're not humans. They need to be taught what our local population eyes look like. So that's the process that that's the stage that we are at the moment.
Yeah, so that's what AI is all about, isn't it? And machine learning. It's about going through that sample size to learn and then have pattern recognition.
Yes, correct. So it's a very interesting stage, but hopefully it goes to the next level where they have these neural networking maps, etc., and can take it to the next step.
Now, Doc, as a society, what do you all have planned moving forward in the next 12 months as part of your overall activities?
So, as you mentioned, one of the things that Malaysian Society of Ophthalmology does is to raise awareness of this disease amongst the community and also our fellow practicing doctors of the importance of these things and for getting their eyes checked, etc. But also we organize social events. We organize CME or continual medical education events. We have a very big meeting coming up next year and the year after as well. Asia Pacific Academy of Ophthalmology in 2023, where about 3,000 to 5,000 people will attend in Malaysia. So we're very excited about that. And we've done these in the past twice before as well. And these kind of activities actually help to put Malaysia on the map. Because a lot of the time our neighbors don't necessarily visit us or see where or know about us, but this helps in a small way to get more tourists to Malaysia. And this is something that has been recognized by the government in the past in the form of grants. Like we've worked together with MySeb, and they've given us grants to organize these large-scale events.
Now, Doc, it's been a fascinating conversation and very educational. Any final thoughts you'd like to leave the general public and our audience with regard to ophthalmology before we end this interview?
Well, I think the overarching message that has come from this is to get your eyes checked, especially all of you who are actually watching this on a screen at the moment. Having a lot or too much of screen time, so many of my patients are actually working from home, and working from home, you're actually on the screen more than you're working at work. And some people are 12 hours, 18 hours. So, you will get fatigue, you will get trouble. And I cannot emphasize enough that you look out for your children and the elderly, those who are not aware of such things, to bring in your parents, bring in your children to get your eyes checked, and don't neglect your own health.
Thank you very much for taking your time to be on the show, Dr. Shunmugam.
Thanks a lot, Brian. Thanks for inviting us.
Now, I'm Brian Fernandez, and I've been speaking to Dr. Manoharan Shunmugam, President of the Malaysian Society of Ophthalmology, on Biztech's Health and Wellness Show. This video will be on our various platforms as well as our website, www.biztech.asia. Please subscribe and like our various platforms. Thanks again for tuning in.